digitalization is not in itself the aim. Digital is just a tool, like we've had countless other tools. Of course, digital offers us, however, the possibility to achieve this paradigm shift. We've been talking for many years, for example, about patient-centered or human-centered care. But in the past, this was kind of wishful thinking because you had to go to a physical point to be treated. So a lot of things were dependent on where you lived, who you were, the distance to the nearest point. Digital can help with that. We've always had problems to access all our data, health data. Digital can help remove those barriers. It can help different professions to work together as a team. It provides a common glue to actually a common basis of information. But of course, this is all potential. And the challenge for the next few years will be whether we can translate that potential to reality. And of course, we have to also use also the new players that are entering the digital health field. I mean, one of the interesting things to note is that you have, in addition to the traditional players, the pharmaceutical companies, the medtech companies, you have a lot of new entrants or companies from the ICT world. And that can be a very powerful addition, as long as they also understand and what the clear objectives of a health system is. Particularly in the European context, we know, for example, I say this because most of these companies are not European. And we have a lot of dialogue with them to ensure that they fully understand that, for example, in the European context, issues like equity and privacy and etc. are of cardinal importance, and mistakes made in those areas can be very, very counterproductive. So the point is, digital is of course not the end in itself. We are not a technology-centered strategy, but it is a key enabler, and I think for the first time we have a tool which enables us to do the things we've been talking about for many, many years. First of all, the fact that big tech companies and also small innovative startups are increasingly and have an interest in health is a very positive thing, because they have a lot of knowledge and a lot of ideas and creativity. However, as I said before, first important thing is that they fully understand the principles, the ethical values, etc., which underpin the health system. That's the first thing. So that's I think work which is well underway. There are two main challenges. First, we have to ensure the interoperability there's a big risk that investments in digital could end up being what we call white elephants. So lots of expensive investments that simply, for example, can't then exchange data with other parts of the system. So we need to have European standards. That's a technical part. But then there's the framework which is needed, the kind of the legislative framework, the governance, to ensure that, for example, people can trust the health data, which is of course the most sensitive of personal data. And when you ask people, we've done countless surveys, and they all come up with the same answer. People are very happy to have data used for their own treatment, for research, for finding new cures, etc. What they're worried about is, for example, the usage or abuse of health data by non-health actors for non-health purposes. So they will say, what happens if my bank or my employer or my insurance company gets a hold of my health data and uses that to discriminate against me because I have a certain genetic makeup? So the answer to that is a very solid governance framework to ensure that, for example, and we are looking at ways to do that in a practical way. But the problem is not, of course, the entry of these companies. They are welcome as long as they start to think like healthcare companies, and they also understand that they are healthcare companies. We have also been taking practical steps. So under the cross-border directive of the European Union, we now have, it's admittedly a small start, but we have already some member states exchanging health data with each other. This is important because more and more Europeans now live and work in countries which are not necessarily their country of origin. They need access to their health data. So we have already the first few countries exchanging patient summaries, e-prescriptions. We will soon have other countries joining in and exchanging also scans and lab results. And eventually we want to move all the way to full health records. So we should make healthcare completely independent of location. And this will be a benefit not just for people who travel or who work in another country, but also in, for example, what we now call more remote areas, because once you have a digital system, it doesn't matter whether you live in a big city or in a rural region.